stop trusting the reading on that machine blindly. If you are sitting down, wrapping that cuff around your arm and pressing start without doing this specific preparation first, you might be getting a false number that scares you into taking medication you don't actually need. What if I told you that the way you are breathing right now, yes, this very second, is sending a signal to your brain that you are under attack? Here's the hard truth. A 2024 analysis suggests that nearly half of adults over 75 are managing their blood pressure incorrectly, leading to unnecessary strain on the kidneys and heart. The medical community calls it resistant hypertension, but often it is just lifestyle ignorance. You are standing at a crossroads today. Path 1 is the standard route. Higher dosages, more side effects, dizziness, and the constant fear of that silent killer striking in the night. Path 2 is different. It is the path where you take manual control of your own nervous system using tools you already have to force your pressure down naturally. Before we begin, I have a request. If you are ready to stop being a passenger in your own body and start being the pilot, hit the subscribe button and turn on notifications and tell me in the comments, do you get white coat syndrome? Does your pressure spike just because you are at the doctor's office? I read every single comment. We're going to break down 7 critical factors, 4 habits you must stop immediately, and 3 specific breathing tricks you must start that control the pressure in your veins. We are starting with the most common mistakes and building up to the number 1 most powerful breathing technique that acts like a natural vasodilator. Number 7, the vascular kink. Most of us think blood pressure is just about the heart or the salt shaker, but strictly speaking, it is a plumbing issue. When you sit on your couch watching TV for hours, what do? You likely slump forward, you cross your legs, you compress your abdomen. We do it because it feels comfortable, it feels like relaxing. But to your circulatory system, this is chaos. When you compress your thoracic cavity by slouching, you are physically restricting the space your lungs have to expand. Less lung expansion means less oxygen enters the blood. Think of your blood vessels like a garden hose. If the water is running and you step on the hose or put a kink in it, the pressure behind that kink builds up instantly. The water has nowhere to go, so it pushes harder against the rubber walls. That is exactly what happens to your arteries when you slump. Your heart has to pump harder, increasing the pressure just to push blood through that kinked posture. Your doctor checks your pressure while you are sitting up straight in a chair with your feet flat. And they assume you sit like that at home. You don't. You sit twisted and compressed, meaning your at-home pressure is likely higher than you realize during those evening TV hours. We need to unkink the hose. The fix is the 90-90 rule. When you sit, your hips should be at a 90-degree angle, and your knees should be at a 90-degree angle, feet flat on the floor. If you are watching TV, place a small pillow behind your lower back to maintain the natural curve of your spine. Do this for just 10 minutes before you take a reading. Posture is mechanical, but the item coming up at number 6 is chemical. It is likely sitting in your medicine cabinet right now, and you take it to help pain, but it is silently driving your numbers through the roof. Number 6, the silent spiker. We all have aches and pains, knees, hips, lower back. It is part of the mileage we have put on our bodies, so you reach for the ibuprofen, the naproxen, or the over-the-counter anti-inflammatory. It seems safe. It is sold without a prescription, after all. Consider Susan, a 76-year-old retired schoolteacher. Susan loved her garden but hated her arthritis. For 3 years, she took 2 ibuprofen every morning with her coffee. She thought she was being responsible. Then, during a routine checkup, her pressure read 160/95. Her doctor almost put her on a second BP medication, but Susan wasn't sick. She was chemically congested. Once she switched her pain management strategy, her numbers dropped by 15 points in 3 weeks. Non-steroidal anti-inflammatory drugs work by blocking certain enzymes to stop pain, but they have a nasty side effect. They cause your kidneys to hold on to fluid. Think of your kidneys like a specialized coffee filter. Their job is to let the liquid pass through while catching the waste. NSAIDs clog that filter. Instead of draining the excess fluid out as urine, the fluid stays in your blood. More fluid in the same amount of space equals higher pressure. It is like overfilling a water balloon. The skin gets tight and ready to burst. We tend to separate our issues. I take this for pain and I take this for blood pressure. We forget that the body is one closed loop. Experts at the Mayo Clinic have flagged chronic NSAID use as a leading cause of drug-induced hypertension, yet many patients never mention their pain pills to their cardiologist. If you need daily pain relief, consult your doctor about alternatives that are friendlier to blood pressure, such as acetaminophen or topical creams like diclofenac gel. The gel treats the knee directly without flooding your whole system with the drug. So we have unkinked the hose and unclogged the filter. Now let's talk about the fuel you are putting in the tank. This next one is controversial because you think it's healthy. Number 5, the dehydration illusion. You drink coffee in the morning, maybe a glass of tea at lunch. You aren't thirsty, so you assume you are hydrated. But as we age, our thirst mechanism, the signal from the brain that says drink water, begins to malfunction. It gets quiet. You are dehydrated, but you don't feel it. Blood is mostly water. When you are dehydrated, your blood volume drops, but the viscosity increases. To compensate for the lower volume and keep blood reaching your brain, your blood vessels constrict. Think of your blood like a smoothie. If you add plenty of water, it flows easily through the straw. If you don't add enough water, it becomes a thick sludge. Your heart is the person trying to suck that thick sludge through the straw. It has to work 5 times harder, creating massive suction to move the liquid. Thick blood requires high pressure to move. Research published in the journal Nutrients indicates that even mild dehydration can impair vascular function in older adults. Your vessels lose their elasticity when they are dry. The Prime Health protocol is the water wake-up. Do not wait until you are thirsty. Drink 8 to 10 ounces of room temperature water immediately upon waking up before your coffee. Coffee is a diuretic. It pushes water out. You need to put water in first. This thins the smoothie before your day begins. Now that we have removed the obstacles, the posture, the pills, and the thick blood, we can actively intervene. This is where the magic happens. The next 4 points are the breathing tricks that manipulate your nervous system directly. We are halfway through the list. If you are learning something new about how your body works, please like this video to help support the channel. It tells YouTube this information is valuable, and share this with a friend or loved one who needs to hear this message. It might just save them a trip to the ER. Number 4, the mouth breathing trap. This is the bridge between a bad habit and a breathing solution. Look at yourself in the mirror or catch yourself while reading a book. Is your mouth slightly open? Are you breathing through your mouth? Let's talk about Arthur, age 78, a former accountant. Arthur snored. He woke up with a dry mouth every day. His wife moved to the spare bedroom. Arthur's blood pressure was stubbornly high despite medication. He was a chronic mouth breather. He was bypassing his body's most important filtration system. Your nose is not just 2 holes on your face. It is a complex turbine designed to process air. When you breathe through your nose, the air is warmed, humidified, and pressurized. Most importantly, the nasal cavity releases a molecule called nitric oxide. Think of nitric oxide like a text message sent to your blood vessels that says, "Relax." It signals the smooth muscle in the artery walls to let go and widen. When you breathe through your mouth, you never send that text message. Your vessels stay tight and tense. You are starving your body of its natural relaxant. We think air is just oxygen. It isn't. How the air enters determines how your body uses it. Mouth breathing is for emergencies. Nasal breathing is for safety. The fix is the mouth tape test. I am not telling you to duct tape your face shut, but during the day, practice conscious lip sealing. Keep your tongue pressed gently against the roof of your mouth. This forces nasal breathing. For sleep, look into safe, medical-grade mouth strips designed to keep the jaw closed. It forces your body to manufacture that nitric oxide all night long. Now that you are breathing through your nose, let's turbocharge it. The next trick acts like a manual off switch for stress. Number 3, breathing trick. Number 1, the 4, 7, 8 reset. This technique was popularized by Dr. Andrew Weil, but its roots are in ancient pranayama yoga. It is powerful because it forces your body to shift from the sympathetic nervous system, fight or flight, to the parasympathetic nervous system, rest and digest. When you hold your breath and then exhale slowly, you stimulate the vagus nerve. This is the longest nerve in the autonomic nervous system. Think of the vagus nerve like the brake pedal in your car. Stress, anxiety, and rushing stomp on the gas pedal. The 4-7-8 breathing technique is you taking your foot off the gas and pressing firmly on the brake. It physically slows the heart rate, which immediately drops the pressure in the lines. Here is exactly how to do it. Sit comfortably with your back straight. Inhale quietly through your nose for a count of 4. Hold that breath for a count of 7. Exhale forcefully through your mouth for a count of 8. Repeat this cycle 4 times, no more, no less. Do this twice a day. The long exhale is the key. That is when the vagus nerve is activated. That technique is for daily maintenance. But what if you are in a stressful moment? What if you are at the doctor's office and the cuff is going on? You need something faster. You need the sniper method. Number 2, breathing trick. Number 2, box. Breathing. This is the technique used by Navy SEALs to lower their heart rate before a mission. If it works for a soldier in a combat zone, it will work for you in the waiting room. People think taking a deep breath helps. Usually, when people take a deep breath, they heave their chest up and gasp. That actually increases anxiety. We need rhythmic, controlled breathing. Box breathing regulates CO2 levels in the blood. If you hyperventilate, you blow off too much CO2, which constricts blood vessels. By holding the breath, you allow CO2 to build up slightly, which counterintuitively helps oxygen detach from hemoglobin and get into your tissues. Think of it like a metronome for your heart. When your breathing is erratic, your heartbeat is erratic. Box breathing sets a steady, slow rhythm. Tick-tock, tick-tock. Your heart has no choice but to sync up with this rhythm, calming down and pumping with less force. Visualize a box. Inhale through the nose for 4 seconds. Hold for 4 seconds. Exhale through the nose for 4 seconds. Hold empty for 4 seconds. Do this for 2 minutes before your blood pressure is taken. It stabilizes the system instantly. We have covered the reset and the stabilizer. Now we arrive at the number 1 most powerful, strange, and effective trick. This one sounds ridiculous, but the science behind it is Nobel Prize-winning material. Number 1, breathing trick. Number 3, the humming bee. This is the technique that supercharges your body's natural pharmacy. It involves sound. Meet Henry, 81. Henry struggled with cold hands and feet, a sign of poor circulation and constricted vessels. His blood pressure medications made him dizzy. He started practicing the humming bee breath every morning while sitting on his porch. Within 2 weeks, his hands were warmer, his morning dizziness faded, his systolic pressure dropped by an average of 8 points. He didn't change his diet, he just started humming. We mentioned nitric oxide earlier. It is the molecule that dilates blood vessels. Research from the American Journal of Respiratory and Critical Care Medicine showed that humming increases nasal nitric oxide production by 15-fold compared to silent exhalation. Think of your sinuses like a bottle of ketchup. Sometimes to get the ketchup out, you have to tap or vibrate the bottle. Humming creates a physical vibration in the nasal cavity. This vibration shakes loose the nitric oxide stored in the lining of your nose, dumping a massive dose of this vasodilator into your lungs and blood. It literally shakes your arteries open. Here is the protocol. Sit straight. Close your eyes. Inhale deeply through your nose. Keep your mouth closed. Exhale slowly while making a low humming sound. Make it loud enough to feel the vibration in your nose and lips. Repeat for 5 to 10 breaths. Do this specifically before you eat or before a BP reading. It is an instant vessel opener. I know how it feels. You go to the doctor and they look at the chart, not at you. They see a number. They see an elderly patient. They don't see the life you have lived or the fear you feel when you think about strokes or heart attacks. It feels like your body is betraying you, like it is slowly breaking down and there is nothing you can do but swallow pills. But you are not a statistic. You are the CEO of your own biology. Your arteries are not rusty pipes that are doomed to fail. They are living tissue. They are responsive. Every time you fix your posture, every time you choose water over caffeine, and every time you hum to release that nitric oxide, you are speaking to your body. You are telling it, we are safe, we are strong, we are healing. Your body is always listening. Neuroplasticity and cellular regeneration don't stop just because you turn 75. Give your body the right signals and it will respond. Let's do a rapid-fire recap so you don't forget. 1. Fix your posture. 2. Watch the painkillers. 3. Hydrate before you caffeinate. 4. Stop mouth breathing. 5. Use the 4-7-8 method to reset stress. 6. Use box breathing to stabilize before reading. 7. Use the humming bee to dump nitric oxide and dilate those vessels. Which of these changes will you make first? Are you going to try the humming bee or are you going to focus on your hydration? Let me know in the comments below. Stay strong, stay informed, and I'll see you in the next video.